Welcome to this Aspiring Medics tutorial on medical ethics. My name's Luke, and in this session, we're going to look at COVID-19 waiting times. So we're going to firstly look at how COVID-19 impacted waiting times. Then we're going to look at why this is the case and what the impact of increased waiting times is. Then we're going to look at some tips and tricks on how to tackle a question on COVID-19 waiting times. And finally, we're going to look through a mock question together. So COVID-19 is a pandemic that has resulted in many thousands of deaths and a significant change in all of our lives since March 2020. There's been a large impact on the NHS, and they've struggled to cope with the peaks of COVID-19 waves, becoming overwhelmed with COVID-19 patients. And this has meant that available resources mainly went to COVID patients, and other services they weren't ignored, but COVID was prioritized over other services in many cases. And this has led to substantial waiting time due to the cancellation of non-essential treatment and also reduced footfall within hospitals and GP services. So more than 83,000 patients waited more than a year for NHS treatment in July 2020, and that's an 81-fold increase from July 2019. And this is largely associated with the impact of COVID-19. So we can look at some reasons behind this increased waiting time. Like we said, during the peaks of waves, many non-essential surgeries and treatments were cancelled and resources were directed towards COVID, which meant that we're going to have to try and catch up these services. There were less staff. This could be due to isolation or due to COVID infection itself. And there have been less doctors that have been able to treat patients, and also less nurses, less radiologists, less healthcare professionals available. There was a large move online at the beginning of the pandemic, with the majority of GP services and some hospital services now having moved online. And this initial move took time to implement, which again led to the cancellation of treatments and led to catch up. And there was also a lack of resources. So there was an interruption of global supply chains, and increased use of resources in the hospitals meant that there were reduced resources for non-essential, or not non-essential, but treatments other than COVID. So the impact of COVID-19 waiting times has led to an overwhelmed NHS. So NHS services are now playing catch up, which is likely to impact services for many years to come. There's been patient suffering associated with COVID-19 waiting times. So due to the cancellation of services, patients have suffered significant morbidity and sometimes mortality. So we're going to use an example from the organ transplantation video. So 487 patients died last year waiting for a transplant, compared to 372 the year before. So we see this increased mortality due to the increased COVID-19 waiting times. And if you remember from that lecture, organ transplantation was actually functioning at 75% capacity, which is quite high given the interruption from COVID. So we see even when we only have this 25% reduction in capacity, we do have an increased mortality rate. And it's caused significant patient upset, which is likely what you're going to be asked about in an interview. So many patients have experienced anxiety and frustration surrounding the waiting times. So we've looked at how COVID-19's impacted waiting times. We've looked at why this is the case and what the impact of this is. Now we're going to look at some tips and tricks on how to tackle a question on COVID-19 waiting times. So we've looked at features of a strong argument before in these medical ethics sessions, but now we're going to look at some features of a strong answer in an MMI situation. So this is dealing more with patient encounters. So this is different because you're not providing an argument per se, you're providing a consultation with a patient. So the criteria for a strong consultation is different. So we want to console the patient, we want to advise the patient, we want to reassure the patient, and we want to explain the issues to the patient. And so this explanation requires honesty, but the rest of these characteristics all require empathy. So you need to try and understand the patient's viewpoint, understand the emotions that they're feeling, and this will mean you'll score highly in your medical school interviews, because empathy is a strong characteristic that interviewers are looking for. So we've looked at tips and tricks on how to tackle a question on COVID-19 waiting times. Now we're going to look at a mock question on the topic. A patient is complaining to you about the waiting times as a result of COVID-19 and is worried about the effect that it might have on their treatment. Pause the video and think about how you would approach this situation. So firstly, you'd want to tell the patient that you understand their concerns and appreciate this is worrying them. Then you would want to explain to the patient that the waiting times are due to increased pressure on the NHS during the pandemic. Then you would want to reassure the patient that the healthcare service is doing everything they can to provide the treatment in the necessary amount of time and to the greatest effect that they possibly can. And then you want to reach a balanced conclusion. Well, you want to reach a conclusion, informing the patient about where they can get help and for more advice. So that could be the NHS website, or maybe it could be their GP. So the two key traits here are honesty and empathy. So honesty, you want to be, in order to nurture the doctor-patient relationship, you want to be honest to them that this is due to COVID-19. This is due to increased pressure on the NHS. And you also want to be empathetic with the patients. So you have to understand their feelings and tell them that they understand that this must be very frustrating for them. And you want to inform them about where they can seek further help if they need it. So looking at some aspiring medics' top tips. So use your background knowledge. There's lots of statistics out there regarding COVID-19 and waiting times, and it would strengthen your answer if you had some to hand. Keep up to date on the topic, so you can use our website, theaspiringmedics.co.uk. Remember to be honest. So in an MMI situation, it's really important to be honest with the patient and also show empathy. So these two characteristics that we were talking about. So it's incredibly important characteristics that interviewers will be looking for. And you can show empathy by reassuring patients, showing that you understand the emotions that they're feeling, and as well trying to console them on the emotions that they might be feeling. So in this session, we've looked at how COVID-19 has impacted waiting times in the NHS, why this is the case and what the impact of this is, some tips and tricks on how to tackle a question on COVID-19 waiting times, and a summary slide. We've also gone through an MMI mock question together. So now you should be well prepared to answer any question on COVID-19 waiting times in your medical school interviews.
Our one-to-one online interview tutoring offers a tailor-made service personalised to your specific universities and medicine interviews, including MMI, panel and Oxbridge. Our expert tutors will enable you to articulate yourself, practice mock interview questions, as well as receive extensive feedback on your performance. You will also gain access to our online interview course with over 150 tutorials and over 200 exemplar answers.